There's a significant potential for cost savings if palliative care is introduced earlier. And when I speak to earlier, I'm referring to at the point of diagnosis. So right from the beginning, when the patient interacts with the healthcare team, it's a great opportunity for them to meet up with the palliative care team at that point to begin to discuss some of the more serious and complex issues that are associated with providing care for the patient. The value of introducing palliative care to the patient is significant. Working in an environment where I am part of a palliative care team, I know that the dynamics that I have with the patient as a pharmacist is quite different from the oncologist. The patient benefits from my expertise as the pharmacist who will provide the drugs, some of the side effect and symptoms management that we can provide. So essentially, for the patient, we have a potential for them to adhere to the medication, potentially for them to understand some of the symptoms and how we'll go about managing it. For the payer, it's a significant benefit because potentially we can decrease healthcare overuse or eliminate unnecessary tests because as a team we have sat together to talk about what will be beneficial and what will not be. Because ultimately it's about what the patient's personal goals are and their preferences. And at the end of the day, we need to incorporate that in the care. And so for the payer to know that that approach has been implemented will potentially decrease overuse of any healthcare resources. In the hospital setting, or even for the institutions, this is great because we currently utilize the benefit of tumor boards. So when we do tumor boards, we have a multidisciplinary approach. Different disciplines can present their thoughts and their opinions. Now, of course, most tumor boards do not have the patient present. In the presence of a palliative care setting where you engage with the patient right at the beginning, you have the value of being able to express, have the different disciplines, share their thoughts. And this will be a great benefit to the institution as well.